you've already know about the Geneva Learning Foundation, and I'm pretty sure you already know about Teach to Reach. This is the Geneva Learning Foundation's regular event for immunization and another primary healthcare professionals to meet, network, and learn from fellow health workers from all over the world. You've probably already heard of it. And here, Kate O'Brien from WHO and Ephraim Lemango from UNICEF explain Teach to Reach as a unique way to link health professionals together. Over the last 9 Teach to Reach, we've been honored to partner with organizations such as Gavi and UNICEF. We've been privileged to work with over 60 organizations as Teach to Reach partners, and we really appreciate the support from Gavi, UNICEF, who have been our anchor partners in the past. To get very practical, here are what partners say and 2 case scenarios, 2 case studies, of how we work with partners. So as VLN Mitchell from Bill and Melinda Gates Foundation said in 2021, we may be actually seeing the pace for how we do things in the future. But now 3 years later, well, here we are. Our first case study from UNICEF and Teach to Reach 9 was focused on identifying and reaching zero-dose children. Ibrahim Dadaria and Deepa Pokaral were guides on the site. They were listening to local health practitioners, sharing their success stories, their lessons learned, and their challenges. So we knew that almost half of Teach to Reach partners, participants, work with the urban poor. This is 42%. Here's an example of one of the question sets that hundreds of Teach to Reach participants took the time to answer. Ephraim takeaways was that co-creation is important, and this innovative approach is exactly what we need. We are now opening up to other immunization partners and would love to welcome you to Teach to Reach 10. Here is our second case study, and this one involves Falaki Olainka and her work as chair of the IA 2030 working group. So here we engage hundreds of health professionals from different levels of the health system to inform the development of the PHC-UHC framework. So we had afterwards 30 and 90 days after we presented the guidance, we asked the participants about their use of the framework, and we received credible specific narratives of actual use and local adaptations of the framework. So here, what did we learn? This was credible, specific narratives of actual use, including adaptation at the local levels, and the examples of how a global guidance developed through a year-long consultative engagement is actually being translated into practice. So there's something new at each Teach to Reach. And here in Teach to Reach 10, it's the first time that we are inviting local organizations, including civil society organizations and local government agencies, as partners. So we've had an amazing response from 1,712 local organizations in English and in French, as you can see there. So the range and diversity of organizations is just really amazing. And it's a real opportunity for partners interested in localization in practice, not in theory, to engage through Teach to Reach. Over the last 3 years, we've seen ascending participation, reaching almost 18,000 participants in October 2023 when we held Teach to Reach 9. So who attends Teach to Reach? Here we have most of our participants working in health facilities and district, half work for the government, half work for civil societies, half are francophones, and there are other characteristics that you can see here. There are some people that work in armed conflicts or that work with refugees and migrant populations too. The major focus remains on the Movement for Immunization Agenda 2030. This is a call for partners interested in IA 2030 to listen and learn from health workers and to use that information and inform their work at the global level. So for IA 2030 partners, you can hear firsthand narratives of IA 2030 implementation at the local levels and share how your organization can support local implementers. So Teach to Reach has 3 stages: before, during, and after the live event. So what happens before Teach to Reach? We ask questions and we work with partners to develop the questions. So these are called Teach to Reach questions, and they elicit dozens or even hundreds of detailed insights and experiences. These insights and experiences are compiled and distilled into thematic summaries, and they're shared with Teach to Reach partners and participants. This is in the run-up of Teach to Reach. Okay, registrants are invited to share their experiences. So here are some of the shared experiences that we already had from previous Teach to Reach. So before Teach to Reach, we also build momentum through a range of activities, including World Immunization Week call for photos. Each year, over 1,000 photos are shared by immunization staff to show how it makes people to make vaccines work, what it takes, how it takes people to make vaccines work. Another example how we build momentum for International Women's Day, for example, just a few days ago, 177 women Teach to Reach participants, specifically, they shared their experiences with their daughters and other young women considering a future career in health. And we have this report that I can share the link later for you to look at. The Women Who Deliver Vaccines Collective is an amazing opportunity for partners working on gender equity to engage with a dynamic collective of women who are actually working in immunization. And this collective specifically is the one that opens Teach to Reach. So now let's go to what happens at Teach to Reach. Participants meet, they network, and they learn through one-on-one discussions. So here are the dates. This is going to be happening on June 20th and June 21st for an English session the first day and French session the second day. And the most important thing is the one-to-one networking in both languages during both days. We also consider that if the people have poor connectivity, all the content goes into a podcast, and partner contributions can spread in this way, even for people who lack the good connectivity. And after Teach to Reach, what happens is that participants share learning insights and reflections. And we work with partners to use the Teach to Reach Knowledge to Action Hub to track and measure how resources, ideas, and tools are used in the field. So this hub provides a mechanism for partners to get inputs and feedback from the field specifically. And this is complementary to other approaches, obviously. So how do you get to be a Teach to Reach partner? So we have 2 options. You can be a partner or you can be a sponsor. So partnership and sponsorship would be, the difference is that you get to connect with health professionals, listening to health workers' perspectives, you get to engage in dialogues. But in both cases, but with sponsors, we have 3 tiers of paid sponsorship. So it would be gold, silver, and bronze. And this helps us fund the next Teach to Reach. And it provides many different ways to engage and support the participants. So this is the opportunity, a very amazing opportunity that it would be great for you to connect with the health professionals, to healthcare workers, to listen to their perspectives, to engage in dialogue, and to support women and men in the front line. If you have, I'm already in my Q&A, but I encourage you, after the session, to reach out to me if you have any more questions or you want any other details. But now I'm here to answer whatever you need. Thank you.
Thank you so much, Maria. We could use just a minute for any questions or comments from the partners online. And thank you so much, Reda, for all the resources that you've shared. You've also shared with us Maria's contact as well, so that we are able to reach out to her. Thanks.
Thank you.
Okay, I don't see any other comments or questions, but rest assured, maybe some will be coming your way